Hello, and thank you all for joining us today. My name is Mia Cifuentes, Research Assistant. Today we're going to talk about some heart health. Heart disease is the leading cause of death in the U.S. The aim of today's workshop is to share information about more common forms of heart disease, hypertension, heart attack, stroke, and heart failure. We'll also talk about some things to look out for each of these. Who can tell us a little about heart disease? Heart disease is an umbrella term for cardiovascular conditions, that is, illnesses that affects the heart. These include hypertension, stroke, heart attack, and heart failure. Let's talk about each of these. Let's start with some basic information on high blood pressure or hypertension. High blood pressure occurs when the force of your blood pushes against the walls of your blood vessels is too high. High blood pressure is defined as a reading of over 120 on the top or over 80 on the bottom. Can lead to other serious problems such as heart attack, stroke, or heart failure. It's important that we note just how common high blood pressure is in the U.S. An estimated 103 million adults in America have high blood pressure, but only half of those individuals have their high blood pressure under control. 80% of people 65 or older have hypertension. High blood pressure is often referred to as the silent killer because there are often no symptoms. It's important to know and talk about your baseline blood pressure with your healthcare provider and to have your blood pressure checked regularly. When your pressure is very high, you may be having a hypertensive crisis. Symptoms of these include severe headaches, severe anxiety, shortness of breath, nosebleeds. If you have or are with someone whose blood pressure is over 180 over 120 and is experiencing these symptoms, call 911. A stroke is a medical emergency. It is caused by either a blockage of blood and oxygen to the brain, or by bleeding in the brain. Both types of blockages causes damage to parts of the brain. Stroke is the leading cause of long-term disability in the U.S. Your risk increases as you age. Stroke symptoms happen suddenly and usually relate to the part of the brain that's affected. These symptoms include numbness or weakness in the face, arm, or leg, especially if it is one-sided, confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, trouble with walking and coordination, dizziness or loss of balance. The person may appear drunk. Severe headache without a cause. If these symptoms develop, get help fast. Call 911. Get to the closest emergency room. Time is brain is a term healthcare professionals like to use to emphasize that acting quickly lessens the amount of brain damage a stroke can cause. A heart attack happens when there's a blockage of blood and oxygen. This block causes damage to the heart muscle. Once damaged, it cannot be repaired or grow back. A heart attack is a medical emergency. In addition to most known symptoms of chest pain and arm pain or numbness, there can be many other symptoms. This includes chest pain or discomfort that lasts more than a few minutes, heart racing, nausea, lightheaded, dizzy, fatigue, pain, discomfort, jaw, neck, back, arm, shoulder, shortness of breath, sudden sweating. If symptoms of heart attack develop, call 911 or get to the emergency room quickly. Time is heart muscle. In addition to traditional signs, there may be other atypical, often vague signs. This is often the case with older adults and women. Some of these symptoms include abdominal pain, back pain, and extreme fatigue. Get help immediately experiencing any of these symptoms. Time is heart muscle. Heart failure can be caused by heart conditions like hypertension or a previous heart attack. In heart failure, the muscle of the heart is damaged, causing the heart to pump less effectively. 5.7 million Americans have some form of heart failure. It's the leading cause of hospitalization of older adults. What does it feel like to have heart failure? Some things you can experience include fatigue and weakness, especially with activity, shortness of breath, especially with activity, weight gain, swelling, especially in legs and ankles, frequent urination. What we know about heart disease is that it is more likely to occur in people with high blood pressure, high cholesterol, and diabetes. We also know that it's linked to stress, low activity, unhealthy diet, obesity, excessive alcohol use, and smoking. Heart disease impacts individuals from all races and ethnicities. Heart disease is the leading cause of death in the U.S. It is more likely to be fatal for adult women than for men. Leading a lifestyle that supports heart health is important. This includes lowering how much sodium you eat and staying active. You may have to make certain lifestyle changes, but it is possible to live with heart disease. Lifestyle changes can include increase heart health, prevent development of heart disease. Be proactive. If you or someone you know has some form of heart disease, try to get as much information as you can about it. Ask your healthcare provider any question you have. Your providers and community resources can support you as you work on your heart health. Working with your healthcare team, including specialists, is major support to understanding and managing heart disease. It's important to be honest with your team about your experiences, especially if something is not normal. We've covered a lot today. Hypertension is a condition that should be monitored. Get help if you have symptoms of very high blood pressure. Heart failure is a result of heart conditions like hypertension, stroke, and heart attack. Stroke and heart attack are emergencies. Act quickly and get help. Work with your healthcare team to manage your heart disease. They are here to support you and your health goals. Thank you everyone for your time today.